Ladies and gentlemen, this is Lions Den with another news and commentary. We're talking about stay-at-home orders, across this country due to the spreading of the coronavirus. Now, we got the state of New York, California, Washington State, already have issued stay-at-home orders. Tennessee is not one of them. And that's a concern for most doctors on this video, what you're about to see. Most doctors in Tennessee is pressuring Governor Bill Lee, even though he refuses to do the stay-at-home order, but they want the doctors want him to realize that if you allow him not to use that stay-at-home order, then more deaths will happen, more cases of the coronavirus happen here in Tennessee will happen. And so I'm going to let you guys watch this video, and these are the doctors are going to explain to you guys what's going on, how bad is it here in Tennessee, and what can Governor Bill Lee do. And I'm gonna tell you like this: it's already on the rise here in Tennessee. It probably, so far as in the thousands. So this video, I want you to, what you're about to see, guys, is basically showing that Governor Bill Lee needs to use that stay-at-home order and to save more lives. So I'm gonna go ahead and play this video, and I'm gonna continue the rest of my commentary. We're back here today because the doctors and nurses on the front line of the COVID-19 pandemic need action desperately from Governor Bill Lee. Governor Lee's failure to issue a stay-at-home order is essentially allowing the pandemic to spread through communities nearly unchecked. There will be at least 1,000 cases of COVID in our state today, and the death toll will only grow from here. There will be more deaths, and many of those could be prevented with strong, decisive action like a stay-at-home order. In a time of crisis, it's really weak leadership to back down from doing the right thing just because it might not be popular with some voters. In 3 months from now, no one will question the bold measures that we are taking to save lives. But there will be plenty of questions if we settle now with half measures and PR campaigns. Governor Lee must do more. You're going to hear today from two of my colleagues who are essentially on the front lines of this right here in Tennessee with their own families, with their spouses, and our message is simple. Governor Lee, your failure to do what is right betrays the nurses and doctors fighting this pandemic. Governor, please use the best, most effective tool we have to flatten the curve, a stay-at-home order, and join the other 20 states in our country that already have taken this bold move. Now I'd like to introduce my first colleague, Dr. Sonal Gupta. Sonal?
Thank you, Aaron. My name is Sonal Gupta, and I studied biomedical engineering at Vanderbilt for undergraduate, attended medical school there, and then left Tennessee for training at University of Michigan, Ann Arbor residency, served as a chief, and then moved back to Vanderbilt and have been at Heritage Medical Associates as an internal medicine primary care physician since 2009. My husband is an anesthesiologist at Vanderbilt, and we are aware that there's a very high likelihood that he will be COVID positive in the future. So much so that he lives in a separate room in our home. We've exchanged passwords to make sure we understand all that we need to in case of an emergency. And have had an international colleague at the age of 40 who is previously healthy, a friend of ours, already passed away from COVID-19 disease. His wife is struggling for her life on the vent, and they have 3 young kids at home. And so our hope is that we can mitigate the disease's effect in our home by this distancing even within the house, and by me performing telemedicine at this time. And Aaron mentioned that we may have more than 1,000 cases by later today, but I think I should also mention that that's detected cases, because I had 4 presumptive positives that I treated by telehealth today and asked them to self-quarantine at home since they had mild symptoms, but did not recommend them getting a test because their symptoms were mild, and we need to save the test for the people that really need them. Our friends that live in New York have been in contact with us and warning us. A colleague in Columbia University is not allowed to be in the same room with someone that shares his skill set in the same specialty. Because if anything were to happen, then the hospital would lose all of their specialists in the area at a time if they are hanging out together. And so they're not even allowed to permit to fraternize in the same room together. Our other colleagues that are in New York are having to duct tape garbage bags to their body because they don't have enough personal protection gowns. They don't have disposable masks to be able to wear, and they're having to reuse things. They're having to borrow things. They're having to wear their kids' swim goggles and bring things in from home that are not made to be used for this purpose. And this is in America. This is in the United States of America, that I've been asked by the Tennessee Department of Health to Velcro a diaper around my face because I don't have an N95 mask to be able to wear to see patients, to do a flu swab when we were still seeing them in the office. We've seen 3 countries. We've seen multiple states. I'm not sure, Governor Lee, how many more examples you need to see how this is going to go if we don't act soon. Epidemiology 101 tells us that when you're trying to play catch up, you're multiple steps behind, and you have to think multiple steps ahead. COVID-19 is at least 2 weeks ahead of us, and more than that in its steps, because that's what we know of, the detected cases that we know of. And if we were to have any chance at defeating this with the least loss of life possible, then we need a stay-at-home order done yesterday. Every day that we delay on this, Governor Lee, please, is additional lives lost, is additional disease spread. And this is overdue. And I don't know how many examples that you need to know that this is the right thing to do, because this is not about Tennessee, and this is not about finances. This is about the human race, and we've seen this over and over again all throughout the world, and we need to not delay. If the worst thing that will happen is that we stay at home and we cancel things and nothing happens, that's the point. Then we can celebrate. That would be the exact goal of what we're trying to do. And if that's the worst outcome, that's something I'm willing to live with. But if that's not the worst outcome, by allowing people to go to their non-essential businesses and do the things that they've been doing and carrying on and going on vacation, are you willing to live with the worst outcome that could come from that? Because we don't know how fast it's spreading, because we're not able to detect due to the lack of tests. And every day that we delay, we're behind. So please, we can fight this fight. We can do it. We just need equipment, and we just need your support to stay at home, because we don't want to give our enemy more power and let them spread in more numbers before we have to fight this fight.
Thank you, Dr. Thank you. Next, I'd like to introduce my other colleague, Dr. Jennifer Martin.
Thanks, Aaron. My name is Jennifer Martin. I am a Kentucky native. I did my undergrad and medical school in Kentucky, and then moved to Nashville 19 years ago to complete my dermatology residency at Vanderbilt. That's where I met and married my husband. I joined a dermatology practice in Middle Tennessee, and I'm a partner position there. Our practice has grown to a very large practice over the last 15 years, and we now have 5 offices and over 80 employees. And so we feel the same financial strains that other businesses are having, but we are committed to saving lives first, supporting our employees, our friends and neighbors who don't have the same cushion that we do, getting proper PPE for the front lines, and then getting the economy back after we shut this pandemic down. Like I said, I met my husband during residency. He's a pulmonary critical care doctor, and so is on the front lines of this pandemic. We've got 3 daughters, and we've chosen to separate as a family to keep me and the children safe while he's on the front lines. He's got a history of asthma, which puts him at a higher risk for complications of COVID. And with shrinking PPE, it's a big concern for us. We, as a practice, when we saw this coming, we decided to shut down all non-essential surgeries and only see patients emergently. Have converted over to a Telederm platform, which has been well received by our patients, who appreciate that we continue to care for them remotely. But until we can get a stay-at-home order statewide, people are still out mingling and mixing, and not everybody realizes that this is a silent, deadly killer, that we're already 2 weeks behind. I think that Governor Lee's failure to act decisively has been confusing for people because they're not sure, should I stay open? I don't want to lose my job. What should I do? There's not a lot of support for that. I think now is the time to act. He needs to issue the stay-at-home order today. Things have been getting progressively worse at a much more rapid rate than our neighboring states. But now is the time for all of us to get that stay-at-home order in place so we can protect the lives of thousands of Tennesseans. I'm not sure how many deaths it's going to take for him to reach that threshold and make a decisive decision, but now is the time.
Thank you so much, Jennifer. So I'm going to close today with just a few quick comments, and then I'll turn it back to Justin. That, my strong belief is that Governor Lee's weak leadership is really undermining the smart, proactive move of many Tennessee cities. So his failure to act early has essentially allowed coronavirus to spread uncontrolled throughout our state. And it also creates tremendous confusion that is undermining the early aggressive steps that many cities' mayors took to protect lives here in Tennessee. A good example of that is just look at the Knoxville News Sentinel story yesterday about businesses staying open in Knoxville. A stay-at-home order is really our only tool left remaining to make the difference here for Tennessee citizens, for Tennessee nurses, for Tennessee doctors, and for Tennessee lives. Governor Lee realized that it's 4,000 Tennessee deaths or 40,000 Tennessee deaths. And my question is really echoed by both Dr. Gupta and Dr. Martin today. How many lives and how many medical professionals is it going to take to be on the right side of history? Please, Tennessee, stay at home. Thank you so much for listening today.
Thank you. We'll have a moment for just a couple quick questions, and then we'll wrap up. It looks like the first question is from Brett Kelman. Brett.
Hi, Docs. Thank you very much for making time. I have two quick questions. First, Dr. Gupta, did you mention that you had been advised to put a diaper on your face as a makeshift respirator? And could you tell us more about that? And then second, Dr. Millstone.
Yes, sir.
Obviously, the governor has been resistant to what you have recommended, and he has not done it so far at this point and has not signaled that he plans to do it soon. I recognize that you are talking about a matter of tens of thousands of lives, so it is a little bit strange to ask for a middle ground. But if Lee is not going to issue a shelter in place, what could he do? What could he do short of what you're asking for that would make the situation better?
Very good. So now why don't you take the question about the diaper first?
Sure.
I'll do the second half.
The Tennessee Department of Health puts out a webinar every Friday since this first case appeared in Tennessee. And before it was more about testing and how to get a test. This last webinar was about if you don't have an N95 mask, it's not ideal, but you can use a bandana, you can use a scarf, you can use a diaper to try to put some distance and some barrier physically between you and the patient when you're getting swabs or when you're doing things. They said if you don't have gowns, for the disposable gowns, that you can use patient gowns and wash them, which that at least makes a little bit of sense, and is doable much more easily, that you can wear a trash bag, that you can wear contractor bags, that you can, instead of people who have masks or shields, that you can wear swim goggles or safety goggles, or at minimum to put some kind of shield between you and the patient in some way. But the problem is that every patient you see, you ideally need to be changing out that gear, and so that you don't risk contaminating the person in the next room that you have to see. And so either people, I know my husband has been given one eye shield that he's supposed to wear, before the rules were to change it every time you go in and out of the OR. But now they're being asked to clean it and wipe it down, and that will be theirs for the duration of the crisis. And so to hang on to it and, write your name all over it and clean it and care for it like it was your very own child. But that's why it's ridiculous that people are resorting to trusting Jo-Ann Fabrics to have the right number of microns thick fabric here to protect us, because people are having to have masks made. I'm a wood turner as a hobby, and wood turners are donating the masks and shields that we wear to have a bigger protection along your face. And so the problem is that we don't have the right equipment. And if our president would, and our Congress would enact the National Defense Protection Act, which allows us to change manufacturing resources and allocated money in times of war, then they could go ahead and have people manufacture ventilators, manufacture PPE, personal protective equipment, and do this in a way that's coordinated at a federal level. But the problem is, because it's not, we have manufacturers that are competing with hospitals, are trying to compete with each other, driving the price up and having these bidding wars on PPE. And it needs to be organized and done on a national, federal level, so this can be done at the right price and get the tools to where we most need them at the right time.
And the second half of the question, Brett, I personally believe there is no middle ground. I think that if you look at the World Health Organization data on the pandemic, it took 67 days to get to the first 100,000 infected in the world. It took 11 days to get to 200,000. It took 4 days to get to 300,000. And it took 2 days to get to over 400,000 infected in the world. That tells you that the pandemic is spreading and accelerating, not on the decline. And I think that if you take a middle ground approach or bite off small bites of the apple instead of making a decisive action, then you're really part of the problem and not part of the solution. It's a great question, and I stand behind that answer based on the statistics of the World Health Organization.
All right. Looks like that's all the questions for now. Thanks, everybody, for joining, and we'll circulate a video here in the next few minutes.
Great. Thank you so much.
Thanks.
Well, ladies and gentlemen, there you have it. Ladies and gentlemen, the doctors here in Tennessee is begging and pleading Governor Bill Lee to do the right thing and sign the stay-at-home order. You got 20 states already has that order, and Tennessee is not one of them. And the more Governor Bill Lee refuses this, the more people will be infected, the more people will die because of this disease. In Nashville alone, the mayor in Nashville already passed a law called Safer at Home law. And what it does is that people can just go, get groceries and everything, but you have to be at home. You got it in a safer manner. The safest place is at home, right? So what I'm saying is that the doctors itself are trying to tell Governor Bill Lee, do the right thing, pass the stay-at-home law like the 20 other states have done, so they can save lives instead of create lives. Obviously, we definitely need, see, the thing of it is that he's like I said, he reminds you of Donald Trump in a way when he says, well, basically we don't need to have a stay-at-home law because citizens, the disease itself will go away. Well, it don't go away. A matter of fact, we got more cases now here in Tennessee than other states like Louisiana, New York, California, and Washington State. So now what you're going to do, Governor Lee? Are you going to basically ignore what the doctors is telling you? Or are you going to ignore what the citizens is telling you? You just don't want to hurt your constituents when it comes to do the right thing. I don't know. But this is important. Again, we're losing so many lives here. So, and like I said before, Governor Bill Lee needs to do the right thing. Obviously, we haven't heard anything yet from him. He sounds like he refuses to even pass this law to have people stay at home than to allow people to go out freely and spread the virus and mainly killing each other because Governor Bill Lee decided, well, like this is the Tennesseans have the right to do whatever you want to do. But my point is that more people are dying. I mean, what you want to do? Rather save a life, or to just get more lives because of this disease? So that's all I would like to say, ladies and gentlemen. But I want you to let you see what's going on here in Tennessee. That and plus, before I go, there's a petition I already posted on my Twitter page, on my Facebook page. I want you to sign it, demanding Governor Bill Lee to do a stay-at-home law, to have sign an executive order to have a stay-at-home law right here in the state of Tennessee. So you go on my Twitter. My Twitter handle is at The Real Lions Den. And you can go on my Facebook, which is www.facebook.com/The Real Lions Den. And you can scroll down, and then there's a picture of Governor Bill Lee, and there's a petition. You can go click that, and then you go ahead and sign it, because we need to come together. I mean, if you live in Nashville, Memphis, Knoxville, Chattanooga, if you live in all these places and you feel that stay-at-home law is the best thing, sign the petition. Force Governor Bill Lee to do the right thing and go ahead and create this law, because the more he refuses, the worse it is here in Tennessee with this coronavirus, or COVID-19 continues to spread like cancer. So leave a comment. Tell me what you think. Like, click, subscribe, and remember to click the notification bell for all the news and commentary. With that being said, this is Lions Den signing off. Deuces.